So mucositis is inflammation of the mucous membranes of the mouth and throat. It's very common in patients who are having treatment for head and neck cancer because we're delivering high doses of chemotherapy and radiation, and that radiation is being directed directly at the mucous membranes. So typical symptoms of mucositis are swelling of the throat, redness, oral ulcers that cause pain, and that makes it difficult to swallow and eat and keep up one's hydration and their nutrition support. Patients also can have dry mouth, taste changes, and those can make it more difficult to eat. So patients who have severe mucositis have a lot of difficulty maintaining their weight and their nutrition and their hydration, and because of that, often they can't complete treatments, and the doctor is forced with deciding whether they need to break the treatment, take a treatment break for a few days for allowing the patient to recover. And there is data that having a treatment break leads to more local recurrences, so we try to minimize it. I can recall a patient who we treated with a head and neck cancer. He received concurrent chemo and radiation, which is a very aggressive treatment. He developed severe mucositis, difficulty swallowing, pain, dry mouth. We used medications, but still the pain was severe enough that he really lost significant weight, greater than 10% of his body weight. And we were forced to give him a treatment break to allow it to recover. And then during that time, we had a PEG tube placed directly into his stomach where nutrition can be essentially injected with a pump to bypass the throat and reinitiate treatment at that time. So mucositis has been a problem for a very long time. There's been very slow advances. There's some improvement in pain medications now that have less side effects. There's a drug that's given IV that can help protect salivary glands from radiation, so patients develop a little less dry mouth. And there also are IV medications that are growth factors that can help the keratinocytes grow and divide. But all of these are small improvements. They're not huge leaps. It's still a significant problem.